Now, the Deputy Prime Minister, Dominic Raab, has said he cannot make any hard, fast guarantees that more restrictions won't be needed in England ahead of Christmas Day. Dominic Raab said the data is always under review, but claimed the country is in a better position to enjoy Christmas with loved ones this year. However, he was unable to offer any guarantees as he advised people to be careful and cautious in the coming days. Joining us now is Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter. Good to see you on Sky News today. Is that sufficient advice, in your opinion? Just be careful and cautious?
No, of course not. We need to spell it out so that it's understandable, which is infection control is a multifaceted operation. Boosters alone will not protect you. You need to wear your masks, wear good quality masks, and avoid the 3 C's. Spell it out. Avoid the crowds, avoid the closed, poorly ventilated places, avoid closed gatherings. That simple infection control measure will go a long way, and really it has to be multifaceted.
There's much talk about potential restrictions coming in perhaps after Christmas. Do you think more measures need to be taken now, with just a few days ahead of the big day?
So whenever we have an infectious agent amongst us, the person who acts fast, acts early and acts extensively will achieve better results. And I know politically it is not convenient to put in restrictions before December the 25th. But if I were acting as an infectious disease operator here, I would be saying, act fast, act early, act extensively. Most times you will get it right. Every now and then you will get it wrong. But you know, you've got a rising tide of warning signals here, which is the case numbers are going up. We've got a variant that we don't know a lot about, and we've got this variant which is bypassing the induced immunity. So we've got some warning signs, and nobody wants lockdowns, but I would say just apply some brakes. Some brakes is better than no brakes.
So when you're talking about brakes and the need to act now, what form does that take? Should it be a lockdown?
No, not a lockdown, but simple, straightforward messaging, which is reduce your gatherings. This is the party season. It is unfortunate that the collision of party season, Christmas and rising case numbers has happened at the same time. So reduce your gatherings, wear your mask, wear it properly, be fully immunized, take your booster vaccines. That simple, straightforward message will see us through into a better place. It's just reducing it a little bit, and then it's magnified at a population level.
Do you think the public are heeding this advice already, reducing their interactions with people ahead of Christmas?
So I have heard that a lot of people listened to the chief medical officer and thereafter reduced their going out to dinners and things. It's very unfortunate for restaurants and the hospitality trade to lose business like that, and they should be supported financially. But really, yes, if the message came clearly from our ministers, which is take your boosters as well as avoid the 3 C's, we would be in a much better place.
Do you think the government is failing to get any kind of message across, simply leaving it to the scientists here?
It is unfortunate, but I can see why, because there's a lot of pressure from backbenchers who mean well, but they are not scientists, and that is the trouble. And this is why I have been reflecting and thinking to myself, why don't we have a coalition of experts from all parties heading this pandemic rather than the governing party? Because the governing party puts pressure on their prime minister, and then we have that ambiguous mixed messages all the time.
If no action is taken now, perhaps not for a few days, what are your fears about Omicron and the spread of it, and coronavirus as a whole?
So my intelligence tells me from my hospital colleagues that they are working at full pelt. The wards are full, the beds are full, everything is at absolute top maximum. We cannot do any more. Therefore, if the case numbers, which show a very steep trajectory, continue, that will translate into cases inevitably in 2 to 3 weeks' time. And then there will be a phenomenal pressure on our National Health Services. And already the National Health Service is not only coping with cases and beds full, but staff absences as well. Staff are tired, ill and scared to be in that vicinity where they may get infected and become ill themselves.
The thing is, according to Sage scientists, we're potentially seeing 3,000 hospitalisations a day certainly as far as England is concerned. But this time last year, we were on 8,000 and the health service was just about able to cope then.
Yes, I hear that. And it may come to pass that we ride this storm. The worrisome signal is the steep rise, that we are on an upward steep curve, and we don't know if we will exceed previous thresholds or not. And because we are seeing that steep rise, it would only be prudent to say, let's take some protective measures and ride the storm rather than allow the storm to hit us.
We know there's a cabinet meeting this afternoon. What would you like the Prime Minister to come out and say after that?
Just take all those precautionary measures. Wear your mask, wear it properly, get your boosters, and don't forget your seasonal influenza vaccine too. It's just as important.
All right, great to talk to you, Dr. Bharat Pankhania. Thank you very much indeed for your time today.
Thank you.